My name is Vijay Anand. I'm the head of the Optometry department at Moorfields Eye Hospital. I joined Moorfields in January 2005.
My name is Simranjit Kaur Gill. I'm the new Deputy Head of Optometry at Moorfields, and I joined 15 years ago, so 2009.
My name's Yatender Badi. I'm a consultant optometrist and joint head of the contact lens service. I joined Moorfields in July 2008 as a pre-reg, and then I've stayed ever since.
We are the biggest hospital optometry department in the UK. We're probably one of the biggest hospital departments in the world for optometrists. So we have 180 optometrists that work at Moorfields. That is about 90 whole-time equivalents. About 20% of that work within our core services. So that's our refraction and low vision services, our medical contact lens services, our paediatric services. But it's really the other 80% that has sort of changed over the last sort of 20 years or so, because they're in what we've traditionally called extended role, but because they're now 80% of the work that we do, they really are just our roles as opposed to extended. We have optometrists that are working within glaucoma, medical retina, cataract, cornea, A&E, adnexal, urgent care, so pretty much every service that runs within the hospital. Not only are they working within consultant clinics where they're seeing outpatients that would be seen traditionally by the registrars or the fellows or the consultants, they're taking up those patients and they're seeing those. But we've now shifted also to moving into optometry-led clinics as well, where again, those stratified patients are being reviewed just by an optometrist-led clinic, which means that these clinics don't have a medical input into them. And if you add up the total numbers of patients that are being seen on a monthly basis within those types of clinic, you're probably looking at about 1,500 patients per month that are reviewed just by optometrists coming into the hospital that are not needing to see a doctor anymore, which is a huge amount because you add that up across the year. It's a big impact that we've had in reducing that necessity for them to take up those clinical spaces.
Working at Moorfields, you learn every day. No 2 days are the same.
In Moorfields, you have education working side by side with research and also the clinical side.
Also, it was the opportunity to develop as an optometrist, both clinically and professionally, working to get higher qualifications. Also with the clinical experience of working in different extended role clinics, bringing that into kind of all-round care for patients.
I love the variety that I get from day to day working here. Like no 2 days are the same. One day I could be seeing patients, another day I'm in a management meeting.
So within our department, especially because we work in lots of different extended roles and in lots of different capacities, there doesn't tend to be a typical day. The advantage of working within the hospital and working within Moorfields is that it's a dynamic kind of workplace.
I love the fact that we work with world leaders in the contact lens field at Moorfields. We've got so many members of staff like Ken Pullum and Lynn Speedwell who are world leaders in contact lenses, and we get to work and learn from them.
You feel like you're making a meaningful contribution on a day-to-day basis, not only within clinics.
If you're passionate about patient care and you want to do more and more, that's what hospital optometry really gives you. We've got individuals that do laser procedures, we've got individuals that deliver injections. It's been different. Every single role that I've had has been different and come with its different challenges, but always something to learn and grow from. It is a whole profession on its own.
I jointly lead the contact lens service along with my colleague Shriti Lankani. I like the problem-solving nature of contact lenses and also the autonomy that is in contact lenses. So in other subspecialties in ophthalmology, maybe if you're working in glaucoma, you always have a consultant that you'll go and ask, but in the contact lenses, the buck kind of stops with you and you are the expert in your field. So I like that fact. And also there's a vast range of conditions that you can treat with contact lenses. The field is always developing and changing, and I find that exciting.
The reason why I kind of have even considered going into a leadership role is because I genuinely care about making a difference. That has always been a personal aim of mine. I love my clinics, love working with patients, but also having an opportunity to be directly influential in changing the way that we provide our care has been a personal ambition of mine. We have optometrists in our senior leadership roles because we have such a big department. I think it's really important because it gives you that progression pathway to aspire to. It shows that it's possible to do something outside of your normal clinical work. And also I think representation is really important. Having people in senior leadership positions who can represent you not only makes it more accessible to you to know that you can actually progress and achieve something that other people have, it also breaks down those barriers.
I think I'm very much of compassionate leadership. I think that's very important in the NHS. There's a lot of talk that's been talked about compassionate leadership. It is that compassion to what they call listen with attentiveness. So actively listen to if people are raising concerns, if people are raising ideas, that you're actually listening to them and taking it forward. And the reason that's really important when you talk about compassionate leadership within the NHS, there's about 1 in 20 adults that work for the NHS. And there's about 1 million patients that get seen in the NHS every 36 hours. And so if you impart that compassion to those 1 in 20 adults, to each and every member of staff that you work with, and you do that to all the patients you work with, it's the knock-on effect on society that you can potentially have by essentially leading that compassion out, not just within the work that you're doing, but to everyone.
From a kind of a female perspective, having representation in senior leadership roles is important. To know that that's not a barrier here and it's not a barrier to achieving what you would like, I think is really encouraging.
I'm actually very proud that actually if you look at our senior leadership team, it is a very diverse team that we have, and it does represent really what we have in the profession, and that's something that I'm very proud of. I think we're in quite a pivotal change of where optometry sits as a profession. We've got the new education training program, so the 4-year degree. But also if we look at what's happening in healthcare as it stands at the moment, you hear the conversations that the Secretary of Health has said over the weekend. You look at the Darcy report that has come out today. All of those things are saying that the key elements that we need to push for is care closer to home, care more in the community, out of hospital care, still maintaining those standards, moving from analog into digital and utilization of AI, and really sort of preventing as opposed to treating. And I think that's where in ophthalmology it's really important, because we have a vast array of workforce that is in the community that hasn't at this moment in time been really given that opportunity to upskill themselves to be able to take on some of that secondary care work that is being done by optometrists within secondary care. And so a hospital optometrist lead role like this is going to be quite pivotal in influencing those changes and how those changes occur, keeping it safe, because that's ultimately what we need to do for our patients, quality assured, and ensuring that the pathways that we set up with community optometry work.
Looking ahead, I see the relationship between primary and secondary care being more integrated and seamless, and more agile with response to the change in innovation in digital technology. Hopefully, this will allow more integrated care at the point of when the optometrist is seeing the patient in practice, giving them access to health records and being able to make decisions at the time before referral. Hopefully, giving better patient outcome measures by avoiding referral if required.
That role of optometrists has changed from just doing the core work of refraction and low vision work and medical contact lenses to really branching out and really helping ophthalmology across the board.